Hi there, my name is Kylie Christensen. I am going to be doing remediation for the skill administering oral medication. I'm going to be doing that from the MAR number 1 version. So first thing I'm going to do, I'm going to verify the doctor's orders in the 6 rights of medication. So I want to make sure I have the right patient, it's the right dose, right medication, right route, right time, and performing the right documentation as well. So first thing you do is you pull up the MAR and you verify the orders and make sure if you have to do any calculations, you're performing those as well. So what's in the orders today? Our first drug is going to be Colace, 100 milligrams. Then we have a warfarin or Coumadin, which is 5 milligrams. And then we have our Lasix, our furosemide, it's going to be 20 milligrams. And then we have our potassium chloride, and that's going to be 20 MEQ. And then our final one is going to be the liquid, which is acetaminophen. It's going to be 500 milligrams per 15 milliliters, and that's what's in the orders. All of our prescriptions today aren't going to need any calculations. They all come as ordered, so I just need to verify in the MAR as I get those medications pulled out that they match the patient's order. So that's what I will do as I'm gathering them. So I'm going to gather all my supplies. I'm going to go ahead and head to the patient's room. I'm going into the room. Hi, my name is Kylie. I'm going to be your nurse today. I'm here to administer some medication. Before I do any of this, before I get started, I'm going to make sure behind me I close the curtain. And before verifying, I'm going to perform hand hygiene. Can you verify your name and date of birth? 2 patient verifiers. Thank you so much. So I am here, like I said, to administer some medication that the doctor has ordered. But first, just a couple questions. I'm going to check some things before we get started. Do you have any allergies? Perfect. No allergies. Awesome. I'm going to go ahead and one more time perform hand hygiene and get my gloves put on. Alrighty, so I'm going to go ahead and check in the chart. This is going to be my 3rd check. The medications, make sure they match correct dosage, correct time, and all of that good stuff. Alrighty, so before I get started with administering, I want to make sure I do my pre-administration assessment. So we want to take a full set of vitals. We're going to check blood pressure, heart rate, because there's acetaminophen. We want to check, make sure there's no liver issues, if there's a fever or have a pain scale provided. I want to check on his bowel movement to make sure there's not an increase in diarrhea or any unexpected things that could come up between last administration and right now. With warfarin, we want to do an INR and make sure he's within that blood clotting range to make sure it's safe to administer that. So once I've done my pre-assessment and make sure everything's clear and good to go, I'm going to go ahead and go over the medications with the patient, see how he wants to take them. Okay, so we have 5 different medications today. One's going to be a liquid medication and 4 are going to be in tablet form. Do you prefer to take the tablet form all together or separately? All together? Great. Okay, so I'm going to go over those with you. So your first medication I have today for you is going to be your Colace. That's going to be 10 or 100 milligrams of Colace in a tablet form. What Colace is kind of like a stool softener to help alleviate any stress with bowel movements. So some side effects might be some abdominal cramping, things are going to start moving down there, or an upset stomach. Adverse effects, if you have any adverse reactions, we want to know about that. That's going to be rash. If you are experiencing any confusion or dizziness, please let me know immediately. So I'm verifying it's the correct dosage. Perfect. 1. Your next medication is going to be your warfarin or your Coumadin. The use of this is going to be for preventing blood clots. So this is going to help thin out your blood. So some side effects of this might be easy bruising, might have some bleeding gums, your nose bleeds, type stuff like that. Adverse reactions would be if you saw any blood in your stool or in your urine. I need to know about that immediately. So this is your Coumadin, 5 milligrams. All right, your next medication is going to be your furosemide or your Lasix. That's going to be a 20 milligram tablet. That is used for to increase getting rid of fluid. So your kidneys are going to release more urine, essentially, is what's going to happen. So it's going to help get rid of swelling and edema, and also increase urination. So that's going to be a side effect. You might have a headache or be a little more thirsty. Some adverse reactions would be extreme fatigue or cramping or any chest pain. We don't want to experience any irregular heartbeat or anything. I need to know about that so we can monitor that if that comes up. Okay, perfect. So that's going to be our 20 milligram tablet of our Lasix. Your last tablet is your potassium chloride. So potassium chloride is used to keep your potassium levels regulated. Some side effects of that might be some increased gas or an upset stomach. Adverse reactions are going to be like a tingly feeling or any chest pain we need to know about immediately, okay? Okay, of those tablets, do you have any questions for me? All right, all sounds familiar for you? Great. So that's going to be my 20 MEQ tablet of potassium chloride that I just put in there. Alrighty, our next one is going to be Tylenol, your acetaminophen. So this is your doctor's ordered 500 milligrams, which is 15 milliliters. So in this, you have 500 milligrams of acetaminophen in your 15 milliliters. So that's what the doctor has ordered. So I'm going to go ahead and make sure there's no sediment. And on a flat level surface, I'm going to go ahead and pour 15 milliliters. Perfect. So I'm going to go ahead and make sure the label didn't get poured on. I'm going to cap it. I'm just going to dry to make sure there's no drips coming down. Put that off to the side. Alrighty, are you ready? Do you have any questions for me? Perfect. I'm going to go ahead and sit you up so that we don't choke on any of these. Patient is sitting in the proper position, and then we're going to go ahead and get started. Would you like some water? Okay, so here are these. Perfect. And some water. Perfect. Alrighty. Next one is going to be our Tylenol. So 15 milliliters. All right, here you go. Perfect. Here's some water for you. Lovely. Alrighty, how are you feeling? Perfect. All right, so I'm going to go ahead and take all of the trash. I can verify the tablets again the medication as I'm collecting this. I'm going to grab my empty cups. I will discard of all this stuff in the trash. Make sure the patient is back in the lowest position, the call light's within reach. I will be back to check on you in about 15-20 minutes, make sure everything's feeling okay. Alrighty, do you need anything before I go? Okay, before I leave the room, I'll perform some hand hygiene, and then I'll take the medication with me and go document my results.